If you could please tell us what her height was.
Yes, her height is 4 feet 11 inches.
Her weight?
Was 112 pounds.
Starting with your external examination, if you could please tell us what your findings were.
So generally, she was an average frame of white female, consistent with her given age of 31 years. She had blonde hair with brown roots. She had blue-green eyes. Her facial bones appeared intact, or to palpation were intact. She had painted fingernails and toenails, and a few tattoos and a couple of different piercings.
As far as her fingernails, were they intact?
Her fingernails were indeed intact.
Did you make any observations with regards to Rigamortis?
Yes, so there was no Rigamortis present at the time of autopsy.
What is Rigamortis or Rigamortis?
It's the hardening of muscles after one dies. So as you die, the muscles start forming more of a gelatinous mass, and so the effect of that is that it becomes harder and harder to actually move a joint on the body. So in her case, there was no more rigor mortis present.
Based on your training and experience, how long does it take for rigor mortis to set in?
It's variable. There's a lot of different factors that play into it. Generally speaking, a good textbook sort of answer will be that the muscles become their stiffest within about 12 hours, and then as time goes on, maybe 24 or 36 hours, rigor mortis goes away.
And how long does it take before you start beginning to see that chemical process?
You can see it fairly quickly after that.
Was there any significance to the fact that you found no rigor mortis in the body of Christine McGee?
Well, it only meant to me that she's probably been dead. Once a body comes to our office or refrigerated, so that changes things a little bit. It slows down the process of rigor mortis, but even so, to me it meant she was probably dead for more than 24 hours, and as well as compared with some of the other findings.
What time did you do your autopsy on the 21st?
I don't know if I have that information.
If I suggested approximately 10 o'clock in the morning,
I know.
that sounds right.
I remember she was the first autopsy I did in the morning. It was like around 10.
Doctor, what is livor mortis?
Livor mortis is the settling of blood into the portions of the body. It's essentially based on gravity. Once you die, your blood flow stops through your body, and gravity will pull the blood down toward the lower portions of the body, the portions that are closest to the ground. And so, in essence, livor mortis is a settling of blood after death.
How long does it take after death for livor mortis to set in?
Again, it occurs pretty quickly, and it's variable, but you can start seeing it fairly quickly after death.
With regards to Christine McGee's body, was there any signs of livor mortis?
Yes, there were.
If you could please tell us what your observations were.
So the livor mortis, or the red-purple areas where the blood had settled, were predominantly in the back portion of her lower legs. And again, it was red-purple in coloration.
As far as, are you familiar with the term blanching?
Am I? Yes.
What does that mean?
Blanching is when you can press an area of redness on the body and make it become pale or normal skin color.
What is the significance of that?
So blanching, when used to discuss livor mortis, means that essentially the areas of the body where the blood is settled, once that blood settles, instantly it's still in capillaries and little blood vessels. Those blood vessels are still intact. So if you press on them in an area that has that red discoloration, if you press on them, the blood will squeeze away and it'll turn back to normal skin color. That redness will disappear for a second. So when you're discussing Ligamortis, blanching of the Ligamortis is in reference to making it pale once you poke your finger on it.
Did you test blanching in the body of Christine McGee?
Yes, I did.
What were your findings?
There was very slight blanching of the lividity.
And what was the significance of any to you?
So once a body has been dead for a little while longer, usually again textbook answers would be maybe 12 hours, 24 hours, the blood vessel walls start to disintegrate, and now the blood that you previously could push away now starts actually staining the tissues. So now when you try to poke at that area and make it blanch, instead the redness remains. And so there's just a small, in Mrs. McGee's case, there's just a small amount of blanching present by the time I examined it. And this is a phenomenon that means a little bit of time has gone by, usually at 24 to 36 hours.
What is the next stage after blanching is no longer present?
Once you get to the point where your Rigamortis is gone and now your Ligamortis is fixed rather than blanching, you start seeing more putrefactive or decompositional change to the body.
Doctor, continuing with your external examination, did you find any evidence of trauma to the body of Christine?
Yes, I did.
If you could, please tell us about that.
So, generally speaking, there are three different types of patterns of injury to her body. The first were stab wounds. The second was evidence that looked to me like strangulation, and the third was blunt force trauma to the body.
If I could please, Doctor, start first with the evidence of stabbing. What evidence was there of stabbing?
There were 6 different stab wounds in the body. There were 4 stab wounds on the left side of the neck and jaw, 1 stab wound on the right jaw, and a stab wound to the upper abdomen on the right side.
Doctor, during the course of your examination and documentation of the injuries you noted to the body of Christine McGee, did you label each of those injuries?
I labeled them in my autopsy report.
And how did you label them?
I labeled them by letter, A through F.
Your Honor, may I approach the witness? Yes. Showing you a diagram, and I ask if you recognize what is depicted in it?
Yes, I do.
What is it?
It's a diagram of the stab wounds of the head and neck.
All right, off of that is the next exhibit.
Objection, Your Honor.
116. Explain exhibit 116. Your Honor, with the court's permission, if the witness could just step off the stand and indicate the lettering, labeling of each of the stab wounds, and then to retake the stand. If you could.
Would you step to the far side of the diagram so that I can see what you are also? Go ahead, please.
So this here's stab wound A of the left jaw, stab wound B of the left neck, stab wound D of the left neck, and stab wound E of the left neck. Over here, this is stab wound C of the right neck.
Thank you, Doctor. You can retake the stand. Doctor, when you use the term stab wound, could you please define what you mean by that?
So it falls under the general injury category of sharp force injuries, and we essentially it's penetration or perforation of the body by an object that has a sharp blade, generally speaking, and it's separated into 2 different categories usually. There's incisions and stab wounds. So an incision is a cut that on the body surface has a length that is longer than how deeply it goes into the skin tissue. A stab wound, on the other hand, has a length on the skin surface that's shorter or smaller than how deep it goes into the tissue. And we just use those as a way of defining what we mean. Just use those as descriptors of what we're talking about.
To go through each of those individual stab wounds, Doctor, if you could please, first starting with the wound lettered A. Could you please describe in further detail your findings, including the location, size, appearance, depth, and direction of penetration for that wound?
Sure. So stab wound A is at the left. It's known as the angle of the jaw. It's 19.7 cm from the top of the head, 6 cm to the left, the midline, and as well as 7 cm behind the plane of the forehead, so in this direction.
CM standing for?
I'm sorry, centimeter. Yes, I'll probably use that interchangeably if that's okay. This wound on what it looks like on the skin surface is 0.4 centimeter by 0.3 centimeter, and it extends into the tissue 0.5 centimeter. But it has somewhat of an irregular appearance for a stab wound, even though in the company it keeps it looks like a stab wound. It's a little more irregular than some of the other ones that I'll describe. It penetrates into the soft tissue of the jaw from left to right.
And when you say from left to right, what are you referring to?
The direction in reference to the decedent's body. So it comes from the left and penetrates towards the right of the body.
You mentioned the term irregular defect. What do you mean by that?
In this case, I really mean in the company of the other stab wounds. This one just has and it'll be easier to understand once I describe the other stab wounds because they have a much more regular appearance as far as wounds go. But this one looks a little bit more. It was sort of difficult to tell at first if it was a stab wound or if it was more of a blunt force laceration would be the term when the skin tears. This was a little more irregular looking than the other ones.
Staying with that wound but moving to your internal examination of the body, did you make further findings with regards to that injury?
There's hemorrhage associated. The wound itself extends only into the soft tissue, so the subcutaneous tissue of the jaw area. And then there's blood or hemorrhage around the wound track. That's essentially all for that one.
If you could, please, based on your training and experience, explain whether or not there was any significance to your finding of associated hemorrhage in the soft tissue around that wound.
Generally speaking, you need to have a blood pressure, meaning you need to be alive in order to have hemorrhage into the soft tissue.
If you could, please, Doctor, describe in further detail your findings with regards to stab wound lettered B.
B, you can see it's right there below the angle of the jaw. Is 20.3 centimeters from the top of the head. I'm sorry, excuse me, yeah, 23.3 centimeters from the top of the head, 8 centimeters to the left of midline, and then 8 cm behind the plane of the forehead. Essentially, it's horizontally oriented, and on the skin surface, it's 0.8 cm in length, and gapes open 0.3 cm. The one feature about this one is a much more regular stab wound, meaning when a stab is made by some sort of blade. And in this one, what you can see is that at both ends, they come to a sharp point at both ends. So that's one of the features, sharply angled margins on it. It's one of the things we look for in stab wounds. This enters into the tissue of approximately 1.5 centimeters. And again, it only hits the soft tissue, no other major structures in the neck. And the direction of this stab wound is from left to right.
Was there associated hemorrhaging internally with this wound as well?
Yes, there is.
And again, the significance of that with regards to this injury?
That, again, it means that Mr. McGee would have had a blood pressure in order to have the hemorrhage be able to make it into the tissues.
Based on your training and experience, what significance, if any, is there to the finding that the wound was sharply angled on both ends?
To me, it means that the blade that made that wound has a sharp angle on both of its edges.
Moving on to wound lettered C, if you could please describe your findings with regards to that wound.
So C is over on the right side of the neck, and it's, again, below the jaw on the right side of the neck. It's 20.3 cm from the top of the head. It's 5.5 centimeters to the right of midline, and then 7 centimeters behind the plane of the forehead. This one is actually obliquely or diagonally oriented, rather than horizontal or vertical. It's at a diagonal, and again, with this one, it's 0.9 centimeters in length on the skin surface. It gapes open 0.2 cm. And each of the ends of this wound are also sharply angled. This one enters into the soft tissue of the right side of the neck, and it hits the outer coating of the mandible or the bone and stops there. There's hemorrhage into the soft tissues of this as well, and it's about 1.1 centimeters its depth of penetration into the soft tissue. And the direction in this case is from right to left.
Doctor, for those of us who don't remember our anatomy, the mandible is...
Oh, I'm sorry, the jaw. It's the jawbone.
Again, the significance of your finding of associated hemorrhage with regards to this wound.
Again, it means that she had a blood pressure when the stab wound occurred.
What is a blood pressure?
The heart pumping blood through the blood through the body is a blood pressure.
Doctor, moving on to wound letter D, if you could please describe your findings with regards to that injury.
So wound D is here back to the left side of the neck. This one is 22.2 centimeters from the top of the head, 7 cm to the left of midline, and then 9 cm behind the plane of the forehead. This one too is at a diagonal, and it's this wound is 1 centimeter in length on the skin surface. Again, it has sharply angled edges on both sides of the wound. As it enters into enters into the skin and soft tissue of the neck, and then this one actually hits the left internal jugular vein. And then around the jugular vein, there's a lot of hemorrhage or blood in the soft tissue, extensive amount around the jugular vein in an area known as the adventitia of the jugular vein. This one has an estimated depth of penetration into the skin of 3.4 centimeters, and the direction is rightward, so from the left toward the right, and then as well as downward.
Dr. Hull, what is the internal jugular vein?
It's one of the large veins in the neck that brings blood from the head back to the heart.
And what is its purpose in the body?
Again, to bring blood. It's one of the major veins in the neck, or one of the major conduits for blood to get returned back to the heart from the head.
To be reoxygenated?
Yeah, to end up, yeah.
And the adventitia, what is that you refer to?
The adventitia is actually the outer coating of a blood vessel. So the internal jugular vein is a blood vessel, and then the outer portion of it is some soft, stretchy tissue that if you end up cutting or stabbing into a blood vessel, the blood's going to leak out into that soft tissue. And so you can see in Mrs. McGee's neck, there's extensive blood around the soft tissue of that blood vessel.
What was the significance of that finding?
You have to have a blood pressure in order to have blood enter the skin, the tissues like that.
If her heart had no longer been pumping, what would you see?
You wouldn't expect to see, especially in that area, the adventitia, you wouldn't expect to see a lot of hemorrhage around it had that injury occurred after she was dead.
Moving on to the wound letter E, if you could please tell us your findings with regards to that injury.
So wound E is the left neck, is in the left neck. It's centered 22.9 cm from the top of the head, 5 cm to the left of midline, and then 6 centimeters behind the plane of the forehead. It's horizontally oriented. It's on the skin surface. It has a length of 1.3 centimeters and a gaze open 0.4 centimeters. It has, in this case, it looks a little different than the other ones I described in that one angle of it, one edge of it is sharply angled on the front portion of it, and then the back portion of it is torn a little bit. So it has abrasions or scrapes of the skin a little bit, as well as a little tearing of the skin in the back. This one actually ends up hitting one of the glands in your neck that produces saliva, known as the submandibular gland on the left side. Again, there's hemorrhage around this wound, and it extends about 2.3 centimeters into the tissue. The direction of this stab wound is also from left to right.
Again, the significance of the finding of the hemorrhage.
It means she had to have a blood pressure to stab her.
With regards to the fact that the posterior margin of the wound appeared different, could you tell us what significance of that there is to that finding?
It doesn't have too much significance to me. In regards to does it look so different, I think it couldn't have been made by the same weapon. It's just probably just the tearing or twisting of a similar knife that just causes the skin to tear, rather than a nice clean stab wound that you see in some of the other ones where you can make out sharp edges. So it doesn't have much significance.
Your Honor,
Yes.
Doctor, placing the photograph in front of you, and ask you if you recognize what is depicted in that image.
This is a photograph of the injuries of the face and neck.
And specifically,
It shows the 4 stab wounds that I described on the left side of the neck, and a couple other injuries.
I'd ask that that be offered as the next exhibit.
No objection, Your Honor.
117. Display that for the jury. With the court's permission, if the doctor could step up to stand and just indicate the location of the stab wounds as opposed to the other injuries she was reviewing.
Yes. Would you step up to the overhead presenter and indicate on that, on the exhibit itself, and then the jurors will be able to see it on the monitor?
Just go over the presenter.
Oh, okay, sorry.
So this here is what I described as stab wound A, and you can see it doesn't have the same type of appearance as the other 3 do. So this is why I describe this as an irregular wound. This is stab wound B. This is stab wound E, and this is stab wound D. Thank you. Doctor, placing another photograph in front of you, do you recognize what is depicted in that image?
Yes, this is the stab wound to the right side of the neck.
And right after that is the next exhibit.
No objection.
Displaying exhibit 118. Doctor, showing you another diagram, do you recognize what is depicted in this?
Yes, this is a depiction of the stab wound of the right abdomen.
And offer that as the next exhibit, Your Honor.
Objection.
119. Explain exhibit 119. Dr. Hull, does that exhibit display the wound that you labeled F?
Yes, it does.
If you could, please describe your findings with regards to this wound.
Yeah, so this is a stab wound of the right upper abdomen. It is centered at 49.5 centimeters from the top of the head. It's 4.5 centimeters to the right of midline. This is obliquely oriented or diagonally oriented on the skin surface. The length on the skin surface is 1.5 centimeters and it gapes open 0.5 centimeters. Both the margins, both the anterior, both the middle portion and the outer portion of the stab wound have sharp angles. The stab it penetrates through the skin and the soft tissue. Here, where I drew it, looks like it hits the rib cage. It does not hit the rib cage. It goes directly by the rib cage and then hits the front portion of the liver, what's known as the right lobe of the liver. And you can see that on the surface of the liver, you can see, again, a wound that looks a lot like this one with sharp angles on both sides. Entirely, it penetrates into the body 2 centimeters, and it's associated with 175 milliliters of blood in the abdominal cavity.
And how far into the liver, what was the shape and size of the wound on the liver itself?
On the surface of the liver, the wound is 1.1 centimeters, and then it extends 1.3 centimeters into the liver.
And the direction of that wound?
Is backwards, so front to back.
Dr. Hull, what is the liver's function in the body?
It has a lot of functions. One of the main ones is to detoxify some of the products from the blood. It also is part of the digestive system and also makes coagulation factors for the blood, things like that. Makes a lot of good sense.
And can you describe the vascular makeup of the liver versus the neck and the other areas you described this one?
The liver is a very vascular organ, so it has, it has a couple different blood supplies, or different ways that the blood goes through it. One's just your typical arteries and veins, but then it also has what's called sinusoids. In essence, it just makes the liver a really bloody organ if you puncture it.
May I approach the witness?
Yes.
Placing a photograph in front of you, doctor, do you recognize what is depicted in it?
This is a stab wound of the right upper abdomen.
Doctor, what is the next exhibit?
No objection, Your Honor.
120. Explain exhibit 120. Remove it from the monitor. Doctor, with regards to the stab wounds you have just testified about, did you determine whether or not any of them were lethal?
Yes.
Which?
Yeah, in particular, the stab wound D to the neck, that is the internal jugular vein, as well as the stab wound to the liver are lethal.
Were both in and of themselves fatal?
Both can be.
And are you able to say which occurred first, either that labeled D or that labeled F?
No.
Your Honor, may I approach the witnesses?
Yes.
Doctor, placing another diagram in front of you, I'd ask if you recognize what is depicted in it.
Yes, this is injuries of the head and neck.
Other than those that were the stab wounds.
Yes, other than the stab wounds.
I mark that as the next exhibit. Filtration.
122. 121, I'm sorry. 121.
Display in exhibit 121. Doctor, first focusing your attention on the neck area, please feel free, if it would assist you in explaining the injuries during the course of your testimony, to use exhibit 121. Just please step to the side of the exhibit, away from the bench so the owner can see the injuries you noted to the neck area. So there's a couple different injuries to the neck. These are blunt force injuries as opposed to the sharp force injuries, and are composed of abrasions and contusions. So abrasions are scrapes of the skin, contusions are bruising of the skin. Over here on the right side of the neck, you have 4 different abrasions. They have sizes 2 by 0.7 cm, this one here, 2.5 by 1 cm, this one here, 2.3 by 1 cm, this one here, and 2.2 by 0.5 cm, this one here. Then, if we shift our attention over to the left side of the neck, there's an abrasion here as well. That's 1.1 by 1 centimeters. And then in the middle portion of the neck, slightly right of the middle portion of the neck are some bruises. You see there's 2 bruises here, this one here and this one here. The top one is 2.6 by 0.5 cm. The bottom one is 0.5 by 0.3 cm. And then right at the center, right with the overlying the Adam's apple area, is 1 by 0.3 cm scrape or abrasion. Those are the injuries of the neck. Doctor, when you use the term abrasion, you said it was a scrape. What is the mechanism of that injury?
Abrasion is one of the blunt force as opposed to sharp force injuries, and abrasion occurs when a blunt object strikes the skin surface and it causes sloughing away of the outer layers of the skin, so essentially a scrape on the skin.
And a contusion, if you could explain, you indicated that it was a bruise, but the mechanism of injury.
So the contusion is a bruise, it's another one of the categories of blunt force trauma, and it occurs again when a blunt object strikes the skin. This time, instead of scraping away the skin surface, you end up with crushing the blood vessels and blood leaking out into the tissues, and that's what you see on the surface is that blood in the tissue, so it's a bruise or contusion.
You can retake the stand, although I may have you get up in a moment. Doctor, based on your training and experience, do you have an opinion to a reasonable degree of medical certainty as to whether or not the contusions and the abrasions you just described to the neck occurred before or after Mrs. McGee's death?
They occurred before she was dead.
The basis of your opinion?
Is a bruise, in particular a bruise, it will not occur unless there's a blood pressure. It's a whole phenomenon of bleeding into the soft tissues of the skin. You need to have some blood pressure in order to have a bruise form.
Based on your training and experience, do you have an opinion to a reasonable degree of medical certainty as to how long it takes for a contusion to form?
It can happen quickly.
Are there a lot of factors that would play into that?
Yeah, the amount, yeah.
Are you able to date contusions based on their appearance?
Not particularly.
Did you further describe the appearance of the contusions that you just described? Their color?
Well, I'm not sure. The the top contusion on the right side, slightly right of the center of the neck, I described as a petechial contusion, meaning that it was composed of sort of little dot-like areas of blood. And the other one I described as a purple contusion.
And as far as the abrasions, did you,
Dry orange abrasions for the most part.
and the significance of any to that characterization?
Nothing particular.
With regards to other indications of trauma to the head, if you would please tell us what your findings were.
So, let's see, and
Yes, the first question.
so she has, in essence, a black eye, periorbital contusion, or bruise around the inner portion and nose of her left eye. She has, her upper lip has features of both a scraped and a bruise, or an abraded contusion of the left aspect of her upper lip, 0.4 by 0.3 centimeters. Over here is it's known as a subgaleal hemorrhage. So this is when we remove the skin, bleeding into that surface of the skin between the scalp and the skull is known as subgaleal area. And so there's hemorrhage there, or bruising there, 8 by 6 cm, that's behind the left ear. And there was also blood identified in the trachea on the internal examination of the body.
And again, the significance of the finding of bleeding and bruising with regards to those injuries you just described.
They're blunt force trauma.
Were there other findings of trauma to the head and neck area?
The only other thing that's notable is the fact that there's petechiae of the particularly lower portion of the face, and as well as in the eyelids and on the surface of the eye itself.
Could you please describe what you mean by that? What are petechiae? You can take the stand. Thank you.
So petechiae or petechial hemorrhages are small bursts of little blood vessels, and so they look like little red dots in essence. They're an important finding forensically, one we always look at, and we always look both on the surface of the face, on the inner aspects of the lips, as well as underneath the eyelids and in the eyes for petechial hemorrhages. And the reason being is because they often go along with asphyxial deaths or strangulation type deaths. And the way that they occur is if in a scenario where someone's being strangled, you can essentially, the reason you die is because oxygen doesn't get into the blood. Or oxygenated blood doesn't get to the head. Those are the two reasons that you die because of strangulation. And so if you put enough pressure on the neck that you stop, if you close off the airways, then no oxygen gets into your lungs. The blood does not pick up oxygen. Therefore, that will end up causing death. But it takes the most pressure actually to close off the airway. If you put pressure on the blood vessels on the side of your neck, which the major blood vessels are your carotid arteries, those are the blood vessels that bring blood to your head, and your jugular veins, the blood vessels that bring blood from your head back down to your heart, if you put pressure on either of those structures on both sides of your neck, you are stopping blood flow to the brain, and therefore you can cause death that way. So in talking about petechiae, forgetting the airway, and I'm just talking about the blood vessels, if you put enough pressure on the neck that you both stop blood flow from getting up into the head as well as coming back down into the head, if you put enough pressure in that situation, you don't have a pressure difference in the blood vessels in your head. You don't create this scenario where too much blood pressure occurs in the head that causes bursting of those blood vessels, which is what causes those little red dots of petechiae. If, on the other hand, you're in a situation where you put pressure on the neck such that it takes a little more pressure to close off the arteries, the carotid arteries that bring blood to the head, versus the more squeezable veins that bring blood from the head. If you're in a situation where you're putting enough pressure on the sides of the neck only to stop blood flow in the veins, then that means that blood can pump into your head. As it's pumping into your head, it can't come back out because your veins are stopped. It's like a clogged plug, and you're bursting the little pipes, the capillaries, and that's what causes petechiae. So that's one of the findings we look for evidence of strangulation.
Doctor, are you familiar with something called Tardo spots?
Yes.
What are they?
Tardo spots are the post-mortem, so after you die, phenomenon of having blood vessels rupture and cause little red spots as well in the body, or on the surface of the body.
Could you spell that, John?
Sure. Tardieu.
Doctor, based on your training and experience, do you have an opinion to a reasonable degree of medical certainty as to whether or not the petechial hemorrhages you just described that you observed during your autopsy of Mrs. McGee's body were Tardo spots?
Tardo spots only occur in areas of lividity. So again, back to the concept where the blood is settled in certain areas of the body, that's where you end up seeing Tardo spots. And lividity, she didn't have lividity in the areas of petechial hemorrhages in the face. So the petechial hemorrhages in her case, in my opinion, occurred ante-mortem before she died.
And what was the basis of that opinion? The basis of your opinion?
The fact that versus the Tardo spots
Yes.
is you need a blood pressure in order to create the petechial hemorrhages, and the facial area did not have lividity. So this was the lividity predominantly was in her posterior legs.
Doctor, was there any evidence of trauma to Christine McGee's extremities?
Yes, there was.
If you could please detail your findings with regards to her extremities.
So all of the injuries to her arms and legs were blunt force injuries. In particular, bruising or contusions, or abrasions or scrapes. So we just start with the right arm. On the outer aspect of the right wrist, there's a 1.1 by 0.3 cm contusion, a bruise. At the base of her right thumb, there's a 4 by 3 centimeter contusion. There's at the inner, so everything's the inner back of the wrist.
If you could stand up, just because I believe the jurors can't see with the Kleenex box.
Sorry. The inner posterior portion of her wrist, which would be this, based on the way our charts are, this portion here, there's a 4 by 2 centimeter contusion. All these have a gray coloration.
Doctor, just as you're describing inner versus outer, if you could just, for purposes of the record, are you describing the thumb side of the hand or the pinky side of the hand?
Sure. All of my references are the body in standard anatomic position, which essentially looks like this. So if I say anterior is the front portion of the hand, and posterior is the back portion of the hand, and then inner,
just for purposes of the record, anterior pointing to the palm and posterior pointing to the top of your hand.
And then the inside is the pinky side or the little finger side. The outside is the thumb side.
Thank you, Doctor. You can resume your seat.
So those were the injuries to the right arm. The left arm had all bruises as well, and this included a 4 by 2 centimeter area of bruising of the front upper arm, a 4 by 3 cm area bruising of the base of the thumb, a 4 by 1.2 contusion of the inner hand and wrist, so this area here, a 5.5 by 3 cm bruise on the back of the hand, a 0.7 by 0.5 cm bruise at the back base of the ring finger, and then a 1.5 by 1.1 cm bruise at the base, the back base of the middle finger.
Moving on to her legs, if you could please detail your findings.
Sure. So there's both a bruising and abrasions of the right leg. So the back inner portion of her thigh, of the right leg, there's a 2.5 by 2.3 cm bruise. There's a 0.7 by 0.6 centimeter bruise abrasions, a scrape of the knee, of the right knee. There's a 1.1 by 0.8 cm scrape below the right knee. There's a 5 centimeter by 3 centimeter bruise of the shin, of the right shin. And then there's a 0.2 by 0.2 cm scrape of the right heel.
As far as that heel abrasion, consistent with an injury you could get from shoe rubbing against you?
It could be something. It's a small abrasion.
Your findings with regards to her left leg, please?
The left leg, so behind the knee, there's a 2 by 1 centimeter bruise. There's an 8 by 3.5 centimeter bruise of the left shin. There's a 2 by 0.7 cm scrape of the shin. The outer outside portion of the ankle, there are 2 abrasions, 1.5 by 0.2 centimeters and 0.4 by 0.2 centimeters. There's a cluster of abrasions that are they're somewhat linear or form a little line that both are in a horizontal and a vertical pattern, and they range from 0.7 to 1.7 cm. That's at the lower portion, the outer lower portion of her left leg. And at the top of the foot, there's some scrapes, 2.6 by 1 centimeter and 0.7 centimeter at the top of the left foot. And then near the top of the toes, at the top of the left foot near the toes, there's a 3 by 2 centimeter bruise.
Dr. Hull, moving on to your internal exam, essentially that which you haven't testified to with regards to the area of trauma, could you please detail your pertinent findings?
So we take a look at the brain, the remainder of the structures in the neck, the heart, the lungs, liver, gallbladder, pancreas, and other than as I described, the liver, the spleen. We look at the organs in the pelvis, including the bladder, ovaries, fallopian tube, uterus, and cervix, and then some of the other glands, thyroid, pituitary, and adrenal glands, and as well as the intestines and the musculature and bones in general, and all of these were otherwise unremarkable.
Were toxicology tests performed?
Yes, they were.
If you could please tell us the results.
Sure. From the samples that I collected at autopsy, there was in blood collected from the heart, there was ethanol or drinking alcohol detected at 0.1 gram percent. And there was sertraline, brand name of that Zoloft, detected at 224 nanograms per milliliter. Additionally, in the fluid collected from the eye, which is known as vitreous humor, in the vitreous fluid, there's ethanol or drinking alcohol detected is 0.13 gram%.
Dr. Hull, you mentioned Zoloft. What is that?
It's a selective serotonin reuptake inhibitor often used to treat depression as an antidepressant.
The level to you?
Is within the therapeutic range.
You mentioned a vitreous ethanol level versus a blood ethanol level. Based on your training experience, are you able to explain the difference between those two numbers and any significance in the difference of the results between those two measurements?
So often you can compare the vitreous fluid, the eyeball fluid, blood, and you often see with ethanol you get, or with drinking alcohol you get two different results. Oftentimes, at least theoretically, because of the way that the eyeball is a closed compartment, it takes a little while longer before the alcohol that's in your blood actually makes it into your eyeball fluid. And that can be a 1-2 hour time lag. So you can sort of tell, and again it's theoretical, but you can get an idea that whether somebody has stopped absorbing alcohol into their bloodstream based on, and is now on kind of the downslope based on the, based on looking at the value in the eyeball fluid versus that's what's in the blood.
The values here again were what, and what was the significance to you?
So the blood ethanol is 0.1 gram%, and the vitreous fluid is 0.13 gram%. And so, from my point of view, it just means she has ethanol in her system.
And that she would be on the downswing?
It tends to be, yeah, theoretically it tends to be on the downswing.
Did Christine McGee, the toxicology, test positive for amphetamines?
No.
Barbiturates?
No.
Cocaine?
No.
Opiates?
No.
As part of your autopsy, did you complete a sexual assault evidence collection?
Yes, it is.
And was that then submitted to the state police crime lab?
Yes, it was.
And you took a DNA blood sample?
Yes.
Dr. Hull, based on your training and experience, do you have an opinion to a reasonable degree of medical certainty as to Mrs. McGee's cause of death?
Yes, I do.
What is it?
The cause of death is stab wounds of neck and torso with injuries of internal jugular vein and liver.
Before you mentioned those were stab wounds D and F?
Yes.
Based on your training and experience, do you have an opinion to a reasonable degree of medical certainty as to whether or not stab wounds A, B, C, and E were in and of themselves fatal or non-fatal?
It's difficult to say.
In conjunction with the other injuries they could have contributed, is that fair to say?
Objection.
Sustained within phrase is pointless.
When you say it's difficult to say, could you explain what you mean?
Looking at of the 6 stab wounds, the 2 that hit obvious vital structures are D and F. Whether or not there would be enough bleeding associated with the other stab wounds to have caused death is unknown for me.
But your determination was it was the other 2 that were the lethal injuries?
Yes, the ones that hit identifiable large structures that would result in death are D and F.
Based on your training and experience, do you have give an opinion to a reasonable degree of medical certainty as to whether or not the contusions, abrasions, and signs of blunt force trauma to the head, neck, and extremities were fatal or non-fatal?
That's difficult to say as well.
If you could explain, please.
The constellation of findings of the abrasions and bruises of the neck with the Field Hemorrhage to me indicate strangulation with asphyxia. And I can't say just from autopsy whether or not that was an asphyxial process that would have resulted in enough brain damage to ultimately end up with Mrs. McGee dying from that alone.
Discussing further the injury to Christine McGee's internal jugular vein, based on your training and experience, can you please describe what is happening to the brain as the internal jugular vein is losing blood?
So as the as the blood is running out of the body, less oxygenated blood is able to get to the brain, and as the blood supply in the body decreases because it's filling out, the signs of low blood flow to the brain start to become apparent. It would be things that are documented like dizziness, and then finally losing consciousness, and then finally dying.
Based on your training and experience, can you describe the approximate amount of blood loss that would result from an injury to the jugular vein as you have described having noted in Mrs. McGee?
Enough to be lethal.
Based on your training and experience, do you have an opinion to a reasonable degree of medical certainty as to the interval of time between when she sustained the injuries to the internal jugular vein and when she died?
It's probably within minutes. It's a large blood vessel.
Based on your training and experience, can you describe the symptoms a person would experience after such an injury is inflicted?
Just generally speaking, what's described with decreased blood flow to the head.
Would you just describe those? Do you have an opinion based on your training and experience to a reasonable degree of medical certainty as to how long a human brain can live without oxygen?
It's only a few minutes.
Do you know how many minutes?
It's often documented as 4 minutes.
With regards to your opinion, would the Mrs. McGee have been conscious for any portion of that interval?
I don't know, based on the other injuries.
Moving on to the liver, based on your training and experience, can you describe the amount of blood loss that would have resulted from the injury that you noted in the body of Christine?
I'm sorry, I'm not sure.
The type of blood loss that you would see as a result of the injury to the liver?
If the liver was the only injury?
Yes.
Oh, I would expect a lot more bleeding if the liver had been the only injury.
Based on your training and experience, can you explain what would be happening to the brain as the liver was losing blood?
Would be the same phenomenon.
Do you have an opinion to a reasonable degree of medical certainty, doctor, as to the interval of time between when she would have sustained the injury to the liver and when she died?
Not exactly.
Did you characterize that with regards to your findings here between the infliction of injury and death?
I'm sorry.
Minutes?
Oh, it would be from the injuries that she sustained, especially with the internal jugular, the liver as well, would be minutes before she died.
Is that in addition to the time it takes for the brain to die, or is that included within that 4 to 6 minute time frame?
Well, it's gonna have two processes. It depends on how quickly the body's losing blood, which in a large vessel is going to be fairly rapid. So once you lose enough blood that the oxygenated blood isn't adequately perfusing the brain anymore, then you have 4 to 6 minutes before you die. So there's probably some additive property to that.
So whatever time it takes to lose the blood plus the 4 to 6 minutes for the brain to die.
Yeah, that's probably better way to say.
Turning now to the cluster of injuries which you testified in were indicative of strangulation to you. Based on your training and experience, do you have an opinion to a reasonable degree of medical certainty as to whether or not the strangulation of Mrs. McGee was the cause of her death?
The strangulation ultimately was, I don't believe, was the cause of her death. Ultimately, it was established as the cause of her demise.
Could you please explain the basis of your opinion?
The fact that if she had died because of the strangulation, she would no longer have a blood flow, and if she doesn't have a blood flow, then if the stabs occurred afterwards, then you wouldn't have seen blood in the soft tissue and all that hemorrhage.
based on your training and experience and the constellation of findings indicating strangulation, do you have an opinion to a reasonable degree of medical certainty as to the mechanism of strangulation?
What, meaning what actually was used to cause the strangulation?
Do you have an opinion?
No.
Did you find any signs of ligature marks?
It's on there.
What are ligature marks?
Ligature marks occur when an object is used to cause the pressure around the neck. And so when you take a look at Mrs. McGee's neck, there are abrasions, but you don't know what caused those. Those could be consistent with something, some object.
And are they consistent with other findings as well?
Yes,
Are they consistent with manual strangulation?
they can be.
Based on your training and experience, do you have an opinion to a reasonable degree of medical certainty as to whether or not she was strangled prior to the fatal stabbing being inflicted?
Yes, I believe she was strangled prior to those tablets.
Did you issue a death certificate in connection with your autopsy of Mrs. McGee?
Yes, I did.
Can I approach the witness now?
Yes.
Placing exhibit or document 4, do you recognize that?
Yes, I do.
What is it?
It's a death certificate for Mrs. McGee.
I'll have that as the next exhibit.
Objection, Your Honor.
Dr. McGee, or
I'll let this no further.
I have no questions, Your Honor.